Welcome to Innovate, Disrupt, or Die, the podcast where innovation isn't just an ideal, it's a way of life. I'm your host and creator of the Innovate, Disrupt, or Die newsletter, Danny Nathan. Hello, and welcome back to another episode of Innovate, Disrupt, or Die, the podcast. This week, I have Ricardo Silva with me. Ricardo, welcome.
Thank you, Danny. It's a pleasure being here with you.
Awesome. I am so excited for our conversation. You have such a varied background. You have been an advisor to the WHO, which sounds incredibly interesting. You've done a ton of work in AI and healthcare. You've been an advisor, a board member, all sorts of fun things that we can dive into. So let's start with the easy question, Ricardo. Tell me a little bit about yourself, your background, and how it relates to the world of innovation.
I'm a regular old nerd. I just like studying and learning. So that's me, which I guess it's good for innovation. It's also something that people think that the nerdy guy is a shy guy, the step behind. So you do not think of this
I
person
don't get
as
shy from you,
proactive,
Ricardo.
but yeah, I like to innovate and reading, learning, and doing is for me the best.
Tell me a bit about sort of your work experience, how you got into the world of innovation, and how you leverage your knowledge today.
Great. So my story is interesting. I was finishing my college years back in Venezuela. I was planning to go into petroleum and automation and all of those things. And I took an elective. Master, I took an elective, Introduction to Biomedical Engineering. There was this old guy.
As an elective? That's a hell of an elective choice, man.
An elective, Introduction to Biomedical Engineering. And this guy, Professor Luis Lara, who was teaching the elective, he was about to create the first clinical engineering department in Venezuela. And they were actually searching for people. After the class was over, I was summoned to the professor's office. And I was, wow, what did I do now? And when I get there, there was not only the professor, but two of his colleagues. And they were like, look, we're about to initiate this project. We need bright engineers. We like the way you presented and built your project. So we would like to invite you to become a member of this adventure. And we will pay for your master's. We will give you a salary and we will allow you to lead the electronic team at this new crazy thing called clinical engineering. And I was like, okay.
That sounds like a heck of an opportunity.
Yeah.
So how did it unfold?
Look, the year was 1996, and the hospital was the Caracas Children's Hospital. The hospital had hundreds of problems and a lot of medical devices. All of the experience I previously had with medical devices is because my grandpa was a medical doctor. That's about it.
Okay.
So suddenly I am the engineer in charge of medical devices directly out of college. I was taking my first classes in my master's in biomedical engineering. So I knew
Wow.
nothing. And well, I had to figure it out. And the first thing I thought of is, well, I need to know what is there. So I had to build an inventory. The only tool I had available at that time was Microsoft Access. And I actually built a medical device inventory management system. Now those things are called computerized maintenance management system, CMMS. At that time, I had no clue. I just needed to figure it out. So
yeah,
I built an inventory for medical devices for the Children's Hospital. And that's how I got started. And in fact, 3 years later, that became a major project just derived from that simple inventory management system that I started building right out of college.
How so? How did it become such a big project?
Y2K. That
Yes. Okay.
problem. And we didn't know in Venezuela how many medical devices might be subject to the bug of the millennia. And truth be told, not much had been done in the country. In fact, 1998 or so, uh, several news media started saying, look, everybody in the world is ready, and Venezuela has done nothing. And I was like, oh, interesting. By that time, we were already working on two other hospitals, and I had already built the inventory management system for the two other hospitals. And I was like, dude, I have the tools to figure out if something is wrong with these devices. And well, let's add a little gadgets and gizmos to the database and figure it out. And then with that, I launched my first startup, and we
Okay.
decided to offer that service to private hospitals. So we initiated with a couple of private hospitals, and August 1999,
Wow. All right.
Ministry of
Cutting it a
Health.
little close.
Oh, really close. So the Ministry of Health called me. Look, we've heard about this weird millennial bug and stuff, and actually the government has created this task force to tackle the millennial crisis, and we understand that you have been working on this thing in healthcare. So, long story short, I ended up leading the national Y2K program.
Wow.
I was a baby at that time.
Right. I'm sitting here thinking you were what, 4 years out of college now at this point?
Yeah.
Okay.
I had to figure out in less than 3 months how to tackle the Y2K problem for the whole country.
How? I mean, what kind of resources did you have? Like how did you go about that?
Well, I had students. I was working at Simon Bolivar University with Professor Lara and the team, so I had access to bright students, and I have the existing hospital workforce. So actually,
Okay.
what we did is we created a training program. We used a two-sticker system and our famous database to figure out what was going on around the country. So 22 states, the heads of all of the hospitals, the main hospitals from each state were commandeered by the minister to come to Caracas so that they can learn what they needed to do. They went back with a couple of diskettes to install them on their system, and they sent the diskettes back to Caracas. Then we had students pulling all of the information into a centralized database and then using the global resources to figure out which devices have been flagged for potential issues and problems. So we were able to inventory over 300 healthcare institutions, something ridiculous like 8,000 computerized devices, which for that time was a big number in 3 months. And we identified the ones with problems. And at the end of the year, out of everything and after our system, we had one equipment fail. So
Wow, that's
my path
impressive.
to innovation was actually a kickstart.
Yeah, it sounds like it. It sounds like it. Where did you go from there, and how did that experience then impact sort of how you got to where you are today?
So that single experience branched into two things. First off, December 1999, we had a major flooding in Venezuela.
Oh,
So automatically, the Y2K response center, particularly healthcare, had to pivot in order to attend the catastrophe. So we had the information, we had the resources. So now we were in charge of attending the catastrophe in the beach next to Caracas. So so my project extended in scope. And at the other side, now we have the inventory of all of the health institutions. So now we were hired to develop a requisition program to purchase new medical devices for the whole country.
Oh my
out of
God.
that inventory. So those were the two immediate derivatives of that original project. Then I came to the US. I did my PhD in neuroscience and neuroengineering, went back to Venezuela, and I ended up in the same group at Simon Bolivar University, but now leading leading the group, created a new master's in clinical engineering. I mean, we started doing a whole bunch of different things, projects, innovation. Now I started working in remote patient monitoring, telemedicine, rural telemedicine, smart hospitals, electronic medical record systems.
Sure.
So those were then the branches that came out. I was a founding member of something called the CENIT, Centro Nacional de Innovación Tecnológica, the National Technology Innovation Center. So
Very cool.
built a couple of smart operating rooms, smart digital view box as remote telemedicine.
Okay. So what did a smart operating room or a smart hospital look like in 2005? I mean, if I think back, the iPhone came out in the middle of that. IoT wasn't even a rumbling in somebody's head yet. So what did that mean back then?
No, so let's start with the rural telemedicine, which is what
Okay.
initiated everything, and then it derived into the smart operating room. But rural telemedicine, you had the jungle, the Amazon jungle. Venezuela shares part of the Amazon jungle, and you had a whole bunch of rural clinic with no resources whatsoever and no way to get a second opinion or to properly derive a patient or even know if a patient needed to be transported or anything. So we needed to get second opinion close to the patient.
Okay.
So for that, we developed a MediCart. That's what we call it. So we had a surveillance camera. We mounted it with an integrated console. There was a computer, the surveillance camera. There was a otoscope. There was a tensiometer, a thermometer, and an electrocardiogram.
Okay.
And that card then was connected to a huge satellite dish antenna. So we actually built one of the first telepresence systems so that the surgeons at the military hospital in Caracas, they could actually control the PTC and zoom in, zoom out, whatever to supervise the patients. And they say, hey, this is cool. Could we do the same in an OR? Like, sure.
Interesting. So was the remote setup that you're describing with the camera also, I assume, transmitting vitals and all of the data off of the sensors and things that you described? Wow.
Yeah.
So you really were creating IoT before IoT was IoT.
Yep. Yes, indeed.
Wow. That's cool. Okay. So then they wanted it in an operating room.
Yeah.
Please keep going. Now I'm
So,
fascinated.
so we did essentially two things. We took the same PTC camera and we mounted it on the base of the operating lamp so
Hmm.
that they could be remotely controlled. So a surgeon from a remote facility could actually assist. So we had a microphone, we have speakers, we had the camera. So the doctor here who was practicing an intervention could actually receive second opinion from an expert surgeon elsewhere. And also students could actually look at the intervention so that they could learn. So this was a smart operating room around 2010.
That that sounds like a career maker in and of itself, Ricardo. I mean, I can't imagine too many people saying, I built certainly your country's, if not one of the earliest in the world, smart operating rooms that was IoT enabled. Where do you go from there and how do you continue innovating after an experience like that?
So from there, I helped develop a manufacturing plan for computers, just clones, but that were going to be built for Venezuelan schools, the Canaima project for education, helped build just before leaving my country. I left Venezuela in 2012. So
Okay.
2011, 12, helped build the first smart hospital. Now, we were not only talking about smart operating room, we were talking about smart green hospital. So yeah, that was a very
Wow.
cool project.
It sounds like it. Okay. So then in 2012, you came to the US, and what
Actually,
changed? What did you start working on here?
I went to Ecuador first.
I'm sorry. Okay.
Yeah. Yeah, there was a project by the current president of Ecuador at that time. Ecuador was way behind all other Latin American countries when it comes to research, development, and innovation. So President Rafael Correa created something called the Prometheus program. And the idea of the Prometheus program was to bring global experts into Ecuador to help them increase their academic skill sets. So I was one of the fortunate Prometheans who got selected, and I actually worked directly with the CENESID. It's basically the Secretary of Science, Technology, and Innovation. So I worked with them, helped them create the first few technology innovation centers. I created a research group in Guayaquil for health IT, which is still operational, worked on the development of the electronic medical record for that is the University Hospital of Guayaquil, helped create the first family medical records, communal family medical records for people who lived in small rural communities to assess the health of the whole family, not just the individual. So yes, it was fun. Ended up in Ecuador being the founding president and provost of a new technology college in Yachay, the city of learning that was President Correa's pet project. Also helped develop technical skills in partnerships, so industrial academic partnerships, made some very significant industrial academic partnerships and raised a lot of money.
Ricardo, it sounds like you have a very unique background in that it has touched both academia and governmental work and innovation and technology and healthcare. Talk to me about how have you seen innovation work in those settings? How have you convinced people in those types of roles that innovation is important and that it needs to be a focus?
Well, you know that it's always better to ask for forgiveness rather than to ask for
Haha,
permission.
yes.
So you just do things and people will follow. For me, I have a very simple concept, and that is where I've lived all my life. Research is taking money and turning it into knowledge. Innovation is taking knowledge and turning it into money. So one thing that I've done all my life is build academic industrial partnerships where the industrial problem becomes a research focus and the output of the research becomes the input for innovation that generates money that feeds the process. And that is a beautiful virtuous circle that once you make both sides understand the win-win in the equation, then it works on its own.
In description, it sounds beautiful, and so there's beauty in the simplicity in the way that you've described it, but I can only imagine that the reality of bringing it to life is far more difficult. So what are some of the challenges that you face in creating that relationship, and do you ever run into, I guess for lack of better terms, conflicts of interest, or people that have trouble sort of accepting both sides of that.
In the traditional US academic system, where it's publish or perish, the income is normally provided by research grants. And then part of the outcome of that research is a publication. When you're working for industry, that is a no-no. If industry is paying you to do research,
It's
they
IP.
want to own the IP. because that is their competitive advantage.
Yes.
So one thing that is, or that was unheard for many years, it was precisely that. Look, if I'm working for a private vendor, I need to sign a non-disclosure agreement. Product of my research and the research of the students that are involved with this product cannot be published. So we have to be recognized in some other way. We need to be recognized for our academic contribution, not by the number of papers, because a lot of we cannot publish, but by income that we generate, by students that we train, by capacities that we build. So let's develop a whole schema that provides the support for the career path for the academics.
Interesting. So you changed the expectation around where the value is delivered for the researchers who are involved.
Absolutely.
You mentioned earlier that your work in building the electronic devices database resulted in your first startup. And I didn't ask the question at the time, but I was curious and still am. I'm assuming that there is a relationship between the system or the schema that you're describing and your ability to start a startup out of the work that you have done born out of academic research. Is that correct?
Absolutely, absolutely. So most work I did before coming to the United States, because there's a whole different beast, was actually in that innovation path. So taking the academic research and turning that knowledge into a path to earning money. So many of those initial startups that I did both in Venezuela and Ecuador were with former students and or colleagues who had worked on these projects, and where we have actually validated that there was a value such that we could actually turn this into a business.
That's fascinating because if I'm understanding correctly, what you're describing then is you got paid to do the validation research that a startup here in the States, for example, would have to self-fund or, raise early stage capital for, but you had a leg up because you had already done much of that work. How is the schema that you described constructed in a manner that then allows you to go and create your own startup out of that research or out of that validation work?
Okay, so let me give you a concrete example. Let's go back to the Y2K.
Sure.
I mean, we had
Okay.
already built the database. We
Uh-huh.
had tested it in 4 hospitals by that time. So we knew that it worked. We had the skills, and I had the students that had worked with me under my supervision in the hospitals developing and improving on this database, because I built the first one. But after that, I became a manager. So I had students trailing behind me that were
Right.
improving on the tool. So those students were the trained resource that you need to move this forward. So we have the knowledge, we have the tools, we have the skills. All we needed to do was put it into practice. So I was
Okay.
full-time academic and a part-time consultant dash entrepreneur.
Interesting. In the startup context that I'm used to, the founder is the owner, or the founding team are the owners of the company until they start effectively trading ownership for money. In the context of what you're describing, is there another player? I mean, I don't know, does the government or does the academic institution begin as an equity holder in the startup as well so that they also see some of the value that is created from the startup?
Sometimes. So actually, this first company was one of the first companies incubated at the
Okay.
technology park at Simon Bolivar University. So first, the Simon Bolivar created Funindes, which was the foundation for research and development, whose goal was to sell the competencies and know-how that the university had. So the broker for the university's services was this foundation. The
Okay.
foundation is owned by the university. It's a non-for-profit owned by another non-for-profit. So
Okay.
yes, the people that worked for the foundation, they received payment for their
Mhm.
services, but as in all non-for-profits, there is no extra money at the end of the exercise. You have no dividends because you have no equity holders. So all of the
Right.
dividends were reinvested into the university.
Right. That's so fascinating. The idea that there are models beyond what we all talk about regularly around here is so interesting to learn about.
Yeah, and that's what I have helped build in Ecuador. So the universities and the CNSC, the schema that I helped them develop was precisely that. So the
Got it.
technology incubators that they built in Ecuador under my supervision were built following this principle and with a
Got it.
much higher success rate. Because the other thing is that here you assume that an incubator has a terrible success rate, that if you have a 10% success rate, you are golden.
Right.
That's not good enough.
Ricardo, you're now based in the US.
Since 2017.
Okay. So about 8 years. What are the differences? What have you noticed working here in the US? How is the experience?
Yeah, yeah. So I'm the oddball again. Throughout my previous life, both in Venezuela and in Ecuador, I was faculty. Okay. I
Okay.
was part of academia. Yes, I was a weird academic, given, but I was still part of academia and academic life. I was a provost before leaving Ecuador. So I know the academic life very well. Now you come here to the United States and okay, so what have you done? Hey, I've done all of this. What have you done in the US? Well, my PhD. Oh, so you're just graduated from a PhD? No, I have all of this. No. That happened elsewhere. That is not valid here. So yes, now I have had to spend this 8 years basically building my credibility here in this country.
So what have you spent your 8 years doing, and how has that come to life as you've been rebuilding your credibility since apparently it didn't count here?
Well, it flipped. So before I was a full-time faculty and a part-time consultant and entrepreneur. Now I'm a full-time consultant and entrepreneur and a part-time faculty. Was able to secure some very interesting projects with the World Health Organization. WHO does some wonderful work and they've been investing in digital infrastructure. They are actively promoting healthcare digital transformation worldwide because we simply do not have enough caregivers to
Mhm.
supply the health demands of the world. So we need to empower caregivers and health systems with digital tools. There's no other way.
Well, and it certainly sounds like your experience, I mean, aligns to that perfectly. It's effectively what you did in South America for much of your career. How are the programs that you're working on with the WHO different from the work that you've done elsewhere? And given what you've described about the sort of credibility issue, I'm curious, does the WHO stamp just for that much more that all of a sudden that's widely respected as opposed to looked down on, or what? How does that kind of come together for you?
Okay, so first off, WHO is a multilateral international organization.
Sure.
Everybody there is from a different part of the world.
Right.
So first off, WHO is open to good people no matter where they come from. Yes, there's a bidding process. Yes, you have to qualify. Yes, you have to prove yourself, but your curriculum and your experience are acceptable and valid, doesn't matter where you earned.
Got it. So you didn't run into the same sort of discounting of your past experience.
No, no. Of course, I had to prove the experience, and I was hired to work into some very interesting data science projects, database projects that complex information systems. And it's wonderful because, again, that broad career path allows me to understand the medical devices, the health needs, and the computer systems and how to connect them in order to get a solution. So it's wonderful working with multidisciplinary teams where you have to speak to all of the medical doctors and all of the specialties and the tech people and the IT guys and the uh, AI and everybody, and serve as a translator to go
Right.
about translating from one language and one domain to the other.
I can certainly see, given what you've described, why your experience fits that role perfectly, Ricardo. Is that role unique and something that you have sort of found your way into, or are there a number of people that sort of play that intermediary in terms of the work that's being done at the WHO?
Look, I'm not unique. I've been well positioned and well trained, but there are a lot of bright, amazing people out there in the world.
Of course.
So, and nothing. If you think that no, it's the me factor. I am the only one that can do it. That's a big lie. It's all
Okay.
about team building. It's all about properly managing a team, and again, leading with example. This team effort, and that is the only way you make a change, and you disrupt and you transform things.
Fair. Uh, I love it. You've also shared something with me that I want to make sure we spend a few minutes discussing. In the midst of all of the fascinating experience that you are also a sci-fi novelist. How did you become interested in writing a sci-fi novel? And then how does the experience that you've described over the past, whatever, 20, 30 years sort of contribute to writing a fun sci-fi novel?
Great. So two things. First, I've always been a nerd. And a nerd that doesn't read sci-fi is not a good nerd. So let's start by that. So so that's important. I've always read, and I love sci-fi above any other genre. So I'm an avid reader of science fiction. So I said during the pandemic where I had a little more extra time, well, let me give it a shot. Put
How
it
hard could it
together.
be, right?
Yeah, how hard can it be? Right. So I started putting together an idea in paper. And when I finally got something through, and I said, hey, people, friends, family, read this. What do you think? Well, you know, this guide to terraforming Mars using a comet is it's interesting. Okay. Yeah, but there's no passion. There's no nothing. There's no romance.
Your academic background shone brightly. Is that what you're saying?
So yes, this is a cool technical document, but I don't think you're gonna get anywhere.
Okay. So how did it grow from the academic version of a sci-fi novel into something that people want to read?
Well, getting the feedback, listening to people and understanding what they said from, hey, there's no romance here. Okay, let's build some romance. Hey, these characters are kind of bland and plain. And then finally I found uh, an editorial system in Spanish in Spain, Universo de Letras from Grupo Editorial Planeta, that actually sold a program for novel writers. They actually offered what I never learned about writing a novel and describing a character and building a plot and creating conflict and all of those things. So with that, I now have a novel that just came out this month.
Is there a sequel in the works now?
It's a written sequel, and there is
Oh
actually
wow.
a partially written third part. Of course, the sequel would need to go through the same
Yeah.
process with Universo de Letras, so I can polish it and get it to the right place.
We've talked a bunch about it, Ricardo, but you haven't mentioned the name of the novel. What is it?
So it's Comet Surfer, but the first book is The Seduction of Nadia.
Okay.
Nadia is this famous comet that we're using to terraform Mars. So my guide to terraforming Mars with a comet, it's still there. It's just buried into a lot of other conflicts.
Well, I am thoroughly excited to get my hands on a copy.
Wonderful.
Fantastic. Is there anything that I haven't asked you that you're dying to share that would really sort of tie a
Well,
nice bow around our conversation here?
the only thing would be to invite potential readers to my website for the novel. That's
Yes, please tell us where we can find it.
net. So cometsurfer.net, I'm trying to make it into a very innovative website as well. So I have a lot of interactive resources and maps and animations and
Oh,
stuff,
nice.
and a lot of AI developed characters, pictures. Yeah, and I'm building the website myself as well. Part of this
Fantastic.
universe building and character building. So it's fun. Anyone who's actually interested in learning more about the solar system and the objects and the resources within the solar system will hopefully find some interesting info on that website.
Got it. So it sounds like ever the teacher that the learning moments are present in the novel as well.
I cannot get it out of my system.
Nor should you. It sounds fascinating. I'm truly excited to give it a read. I too love sci-fi, and so it sounds like it would be right up my alley. Fantastic. Ricardo, it has been a fascinating conversation. I really appreciate you taking the time to tell us all about your diverse experiences and how innovation has been a through line, and I look forward to reading the book.
Wonderful, Danny. It's been a pleasure being here with you.
That's it for today. Thanks for tuning in to Innovate, Disrupt, or Die, the podcast. Join us again for our next episode, and don't forget to subscribe at innovatedisruptordie.com. That's all, folks.